The Cardioband system is a surgical band delivered through a 24 French transfemoral delivery system. The Cardioband is implanted in supraannular position with multiple anchors. The system includes the implant itself, a transeptal steerable sheath, an implant delivery system, a size adjustment tool, and a number of anchor drives with an anchor attached on top of it to fixate the Cardioband on the annulus. The procedure is performed under general anesthesia. Transesophageal 2-dimensional and 3-dimensional guidance is used, as well as fluoroscopy guidance. The delivery system is inserted into the left atrium. A sequence of multiple anchors are implanted from the anterolateral to the posteromedial commissure in a counterclockwise direction. Usually between 12 to 17 anchors are used to fixate the band along the annulus. Once the Cardioband is completely implanted, the first delivery system is removed and the size adjustment tool is advanced over the wire inserted on the cinching mechanism, which allows precise adjustment of the size of the Cardioband under echo guidance to improve coaptation and to reduce MR. Once the desired size is achieved, the adjustment tool is removed. This Cardioband transfemoral implantation was performed in July 2014 in Asclepios Clinic, St. George, Hamburg, in a 67-year-old male patient with ischemic severe MR and low ejection fraction that underwent CABG in 2006. The annulus was sized with CT scan and a Cardioband appropriate size was chosen and implanted on the delivery system. The procedure involves few steps, including a transeptal puncture, system insertion, implant deployment, implant adjustment, and the system removal. First step involves femoral vein and artery puncture. In the artery is inserted a 6 French introducer, in the vein an 11 French introducer. Transeptal access is carried out in common fashion using fluoro and echo guidance. Bicaval view is used to obtain an inferior puncture. An ideal height to the annulus should be below 3 centimeters. Once transeptal puncture is performed, an Amplat super stiff guide wire is directed to the left upper pulmonary vein, and the transeptal sheath is inserted into the vein itself. Transeptal steerable sheath is advanced over the Amplat's guide wire and introduced into the left atrium. This guide catheter is a 24 French and allows to maneuver the device towards annular targets by increasing the angle, passing from the anterior to posterior commissure. Second step involves the advancement of the implant delivery system through the transeptal steerable sheath. Proper de-airing is performed to reduce the risk of embolization. Firstly, an Ironman guide wire is advanced into the left ventricle. This guide wire allows stabilization of the implant delivery system for the first anchor implantation. In this image, you can clearly see the delivery system, which is now facing the anterolateral commissure. Once the ideal location for the first anchor is identified by multiple imaging, the first anchor is then implanted into the anterolateral commissure. As you can see here, the 3D echo shows a nice position. The anchor is implanted using a torquable system which has been specifically designed. Pull test is performed showing that the anchor has been precisely implanted into the muscle. Once the anchor is implanted, the Cardioband is deployed to prepare for the second anchor. The delivery system allows multiple dimensional adjustment to preserve perpendicularity. The maneuvering of the Cardioband delivery systems will allow the reaching of all the target positions along the posterior annulus. The second anchor drive is advanced and the second anchor is positioned posteromedial to the first one, going in a counterclockwise fashion from the anterior commissure towards the posterior annulus. This video is an uncut video in fast-forward mode that shows that usually a complete implantation is performed in about 75 minutes. So this 10-minute video is about showing you how the implant is performed from commissure to commissure using fluoro and echo guidance, repeating the same steps of the procedure all the time. Once the annuloplasty is almost all implanted, it looks like a surgical ring. At this time, implant delivery system is removed. Curves are released to allow proper removal of the catheter. The Cardioband is left attached to this tiny nitinol wire which is connected to the cinching mechanism. This wire will allow the following positioning of the size adjustment tool. Size adjustment tool is advanced over the wire reaching the cinching mechanism which is located on the Cardioband just implanted. At this time, the Cardioband is not acting actively, still implanted, but not yet cinched. Size adjustment is achieved by rotating a knob on the size adjustment tool, as you can see in this cadaveric study done at TVT last year. You can see the baseline MR is severe with a large surface of non-coaptation and a large pisa. The size of Cardioband is progressively reduced. Multiple adjustments which provide a reduction of MR until the MR remains minimal and also until you get a very important reduction of septolateral dimension. Once the proper size is achieved, the size adjustment tool is detached from the implant and the all system is retrieved and removed from the septum. The access is secured with a figure of 8 or a closure device. In this picture, you can see the final fluoro and echo results that shows a very important reduction of the size of the annulus as well as a consistent reduction of MR, which is also witnessed by reduction of the septolateral dimension.